Hi everyone, my name is Zainab Awan. I am a general paediatric consultant working at St Mary's and Imperial, and I'm also the asthma lead. This is a video for Ask About Asthma Week about the Tier 3 course that we ran here recently. So there is now national guidance that all healthcare professionals looking after children and young people with asthma should have a certain degree of training in accordance with the National Capabilities Framework. This is traditionally in Tier 1 to Tier 5, and Tier 3 is the minimum standard really that we should all be at. The course is usually done online, but we wanted to do it in person for a number of reasons really. First of all, just to train as many people as possible on a one day, but also to bring people together, to have some networking, to build some relationships, to have some really close communication, to share ideas, to share expertise and knowledge, and to really have a really enjoyable day. I must give credit to the team at NHS England, so to Jen Townsend and Vimal in particular, and I must also give credit to the team in Cambridge, so the paediatric and respiratory teams there. They actually ran the course before us. They were certainly the first regionally, and I think maybe nationally, and really helped us and provided a lot of the materials that they had used. And meetings like that, hopefully videos like this, are all really helpful in moving forwards, and all of us really supporting each other to train as many people nationally as we can. And certainly it was a group effort from us as well. So our team here in Northwest London, who are a multidisciplinary team, everyone really came together, and that was a really supportive and exciting process as well. So as I said, much of the course material had been provided to us by the teams that I've mentioned. We did make some modifications to the presentations for a number of reasons really, to stick to time, to make sure that if there were any extra areas of knowledge that we wanted to add in, anything extra the speakers wanted to mention, and also some of the technology aspects so that we could make the course really interactive for the audience, so using tools such as Slido and Mentimeter, for example. When designing the timetable, we did a mixture of lectures, seminars and workshops. And again, this was really just to make, keep everyone enthused and engaged so that the day doesn't feel too long. And within the workshops, we provided things like laminates. So for example, smart asthma plans or annual asthma reviews. And really, I think that just, again, facilitated everyone to have some really rich discussion and, get some guidance and knowledge and expertise from the speakers, but also, to share their own ideas, which was exciting. We used Eventbrite to kind of create the tickets and the links, and we were really keen to do the course free of charge, again just so that it was as easy as possible and as many people could attend as possible. We did have some help with sponsors, so the kind of GP education team, and also some companies who kind of provided equipment like inhalers to look at inhaler technique and peak flows, and that really went towards the cost of refreshments and food for the day, which I think is necessary in a long day. So we had a couple of tea and coffee breaks and a lunch break as well. And again, those were just really nice opportunities for everyone to come together and have a chat and share ideas and get to know each other. The audience was a real mixture. So we had GPs, paediatric consultants, doctors in training. We had asthma nurses ranging from primary to tertiary care. We had physiotherapists. We had lots of asthma nurses who were based in schools, lots of pharmacists, and that was, I think, just really exciting to have everyone really come together. And actually, having said that, the faculty was a real mix as well. So within the faculty, again, we had a representation of pharmacists, senior asthma nurses, paediatric consultants, doctors in training. And I think, again, that just made the whole day much richer. At the end of the day, we also had a panel discussion, which again, just was a lovely opportunity for everyone to come together, bounce ideas off each other. I did keep a reserve list for some people who weren't able to sign up straight away. And so if there were any last minute cancellations, we did get in touch with those people and they were then also able to attend. I must say I was quite taken aback or, overwhelmed from the amount of interest in the course. So it was really, oversubscribed and people were unable to get tickets. And I think that just goes to show, how much there is a need and how much there is interest. So hopefully, we can all put on courses moving forwards and encourage everyone to attend and get the training and the accreditation, so that we're all really working at the same standard and we're really up to date with our knowledge. The feedback that we received overall was really positive. Everyone said that it was really nice to meet people, that they really felt that they learned a lot from the course. They felt that they really were upskilled and felt more confident in delivering care. So that was just really exciting to hear. I think when you're running a course, it's quite difficult to tell how it's going. But one of the things I did notice on the day was just everyone was quite engaged. So there were lots of questions, there were lots of comments, everyone was, sharing their own cases. And that was just really lovely to see. So hopefully this was the first time that we ran the course. I think it was a success. I'm sure there's lots of learning that we have from it as well. But please do get in touch if you have any questions or if there's anything else that I can help with. And enjoy the rest of Ask About Asthma Week.